the week. And what we do is to start with Smileology in Destin, Florida. We do a whole week worth of full arch restorations. And yesterday we did a lower arch with Chrome and a little bit of a I'd say deviating from the plan, but we recovered well. You did an amazing job doing that. And this morning we did uh, a maxillary arch on a patient, edentulous, and it was planned for a little bit of bone reduction. And then we did it flapless. I asked you to try doing it flapless. So tell me about your experience doing it flapless today.
Well, interestingly, it was planned for, doing standard flap and bone reduction and all that. And you said, well, let's do it flapless. Let's try it. And really interestingly, it turned out great. A very minimal inflammation to a tissue or anything like that, and it was very easy, very quick.
Right.
Very efficient.
We also documented it for you. So what we did was that we took the pin guide, and usually where you have to make your incision on the crest,
that's right,
and flap it back.
Yeah.
We kind of just tissue punched it.
That's right.
Where the osteotomies was going to be, and then removed the tissue that was tissue punched, fitted the osteotomy guide down, made sure that it's seated 100%, and then you followed the protocol, your drill protocol, with your first drill, your bone drill, to flatten the bone to where it needs to be, and then your pilot drill, and then we did soft bone.
Well, protocol. We did soft bone, and we over-engineered too. Right?
Absolutely.
So if you think about it, we have a pretty edentulous patient with quite a bit of resorption, and still managed to place 7 implants.
Absolutely.
So
and we got torque on all of them.
Very good torque. Yeah, over 35 on
all of them.
Super soft bone though, and so I think that by not having so much reduction, by not doing any of this drastic cutting, I think we preserved a lot of the bone, and for that reason, I think we had better torque.
Right. So the advantages of doing something flapless, would you say, less invasive?
For sure, less invasive.
Controlling the bleeding, obviously, because you only have smaller osteotomies in the tissue, and her healing time after the fact is going to be a lot less.
Yeah,
so she'll recover quickly. Say in a week and a half. Where usually it's a little bit longer.
And we were also working on a highly compromised patient,
Absolutely.
right? With lots of medications, blood
older,
thinners,
older.
things like that. So older. So certainly kind of a difficult case that needed. We needed to be efficient and quick. I think we got done in less than an hour.
Yes, so the whole procedure, and you did a lower arch as well.
Right.
So with some teeth that you extracted, placing implants immediately.
We even did a crown.
Exactly, and you did a crown. So we did the whole batch today with Dr. B. He is very accomplished, and I love spending time with him and his whole team at this office with Smileology, with the Chrome Week. But thank you for having us today, and thank you for trying this procedure. So what we'll do is that we'll use this training, all the videos that we made today, for training for other doctors, and if other doctors can call you, on just asking questions, maybe,
absolutely,
definitely.
Absolutely. I mean, I'd help anyone at any time. You know how I am. So, but one thing I'd say about this particular technique that's very advantageous is that, we're not confined to doing it flapless.
Right.
So at any time, whatever happens, we can flap. Right.
Absolutely.
We can just pick up to where we normally go to,
exactly.
and so that gives us a lot of options.
Right.
One option to be very efficient and quick, but you know how that goes, right?
Because a lot of doctors want to see the bone.
That's right.
They want to see where the implants are integrating, and I've done it where we've done it flapless, and then we've actually opened it up a little bit, so the bars there, we open it up just above the bar.
That's right.
So use like a 2 or 3 millimeter, kind of reflection, and then they can actually see where the implants are.
Yeah.
Subcrestal, etc.
Yeah.
So,
I think that's probably the best method for somebody that's edentulous.
Absolutely.
I don't see any reason why I would do it any other way.
Right.
Maybe short of having even with somebody that has deficient keratinized tissue, you could still flap very lightly around it.
Right.
There's no reason to do it any other way.
Absolutely. Yeah. So thank you again for trying this technique. and we look forward to the rest of the week.
I can't wait till having you the rest of the week and, next month and maybe after that.
Thank you so much, Doc. We appreciate it.
Love you, Thomas.
Thank you.